Good afternoon. Thank you for joining us for Local 4 News at noon. The coronavirus tops our noon newscast. We just spoke with Governor Whitmer about the surge and vaccine hesitancy, and here's what she had to say to those who have still not been vaccinated.
I think that there is a sizable part of the population globally that won't avail themselves of the vaccine. It's distressing. I wish they'd reconsider. I know we don't see eye to eye politically, but on their health, there's no question that a vaccine and a booster is the best way to stay out of the hospital. We got to put our political differences on other issues. On public health, though, I'm working so hard to protect everyone, regardless of their political views. And I just will continue to try to educate and encourage. But we recognize we're going to learn to live with this virus. And that's why I think helping people stay out of the hospital and to stay alive is the most important thing we as government can do, and work with businesses to make sure they've got tests, and work with our schools and our hospitals to make sure they've got support. And that's where all our focus is.
Meantime, state public health officials are providing an update on the COVID-19 pandemic. Our Megan Woods joins us now live with a look at what they're saying. Good afternoon, Megan.
Good afternoon, and as you can imagine, they had a lot to talk about with this recent surge, including new testing efforts, as well as how many children are in the hospital right now battling COVID. So the Michigan Department of Health and Human Services announced they are deploying 200 more ventilators to hospitals across the state, and this week are expanding testing efforts by giving free home COVID tests to some public libraries, including ones in Taylor and Detroit. While federal teams are at 5 different Michigan hospitals to help with staffing, they continue to stress limiting infection and hospitalization starts with wearing a mask, getting vaccinated, as well as boosted. On that call, it was also mentioned models expect cases to peak between the end of January and early February. Then, hopefully, after that, the number of cases will go down.
Now, what's really up to us as a state is how high do we want that peak to be? Because I think that if we don't use the tools we have, and we have a lot of tools, if we don't use the tools we have, we can expect those peaks to be at those really worst case scenarios that I showed you. So we have a choice to make.
And that choice, again, is to do what we can to help that peak go down. She also talked about how the numbers we're seeing are numbers that we haven't seen at any point in this pandemic before this. So that's very concerning. We talk about some of the other trends they're seeing here in Michigan tonight at 5. Live in Detroit, I'm Megan Woods, Local 4.
All right, Megan, thank you. And